So is rice still good to use for inflammation?
Oh, I was going to say, I like rice.
I know, you thought,
I do like rice.
why are we doing a negative rice video?
Vegetable fried rice?
No, so we're talking about the rice protocol, the rest, ice, compression, elevation. I'm Dr. Brad Weening, welcome to Talking with Docs.
I'm Dr. Paul Zalzal. So, rice, the acronym rice,
the
as opposed to
acronym
the
rice.
grain rice.
Yeah, so there's some talk about some people saying, well, listen, if your body's trying to be inflamed, maybe you shouldn't stop it. And you and I have had this conversation about the fever. You know, your body's trying to raise its temperature to get rid of a bacteria or virus or fight off something.
Yeah.
Maybe you shouldn't knock the fever down. Maybe you should just ride it out. You know, you got to sweat it out.
And that's our battle with medicine is often, you know, the body's naturally trying to do stuff. And when do we intervene? When do we stop, right?
Right, and obviously if your fever gets to like 106 or something like that and it's causing a seizure or threatening your life, then obviously you got to knock the fever down.
Right.
But I think it's tricky to know the exact right answer. So the rice protocol was invented or coined by this guy, Dr. Gabe Merkin. Gabe.
Welcome back, Cotter.
Yeah, that was Gabe Kaplan, not Gabe Merkin, but I like that.
Yeah, right.
Was it Gabe Kaplan? I think it was Gabe Kaplan.
Yeah.
So Dr. Gabe Merkin at the University of Maryland was a professor there and said, well, listen, if we rest these injuries and then we ice them to reduce the swelling and then we use a wrap of some sort, like a tensor bandage, and then we elevate, this can all work to reduce the swelling and get people back faster.
Problem solved.
Right, so even though Dr. Gabe Merkin recently would say, you know what, maybe we didn't have it quite right. Maybe we were doing it too aggressively and maybe there's a better way to use some of the things we learned to reduce the injury. So how do injuries work? So when you have a soft tissue injury, you trigger an inflammatory cascade.
Right, and inflammation is an important part of the body's function because it does serve a purpose.
Right.
Inflammation briefly is when some sort of trauma or stimulus occurs.
Right.
Your blood vessels dilate, so they let more blood get there, and blood carries with it obviously more oxygen and things that you need to help heal.
Yes.
They carry away any toxic substances, lactic acid and that. It regulates temperature. That's why things warm up after their injuries, right? So it heats up a bit. That might speed up some of the body healing processes.
And bring those chemicals that you talked about, prostaglandins, cytokines, histamine, and then other repair cells eventually to come in and start fixing all that damage.
Right. And so the question is, well, should you interfere with that pathway?
Yeah. And I think the answer is maybe.
to a degree.
Right. So now what research has done is said, well, let's do some studies. Let's look into this and see if we just isolate a lot, and we take anti-inflammatories that attack the inflammatory pathway from two different sides, knock it down, is this going to hinder repair? So what they have found, there actually was a study that showed that for short periods of time, it's okay.
Yeah, because it hurts. Part of the inflammatory process is pain, and the pain encourages you not to use that body part that you just injured to give it a chance to heal.
Yeah, and there's a research paper in 2015 that showed that if you ice it too much or for a prolonged period of time, it actually reduces your body's ability to heal it. So 100% it's going to reduce the fluid and going to reduce the pain, but it actually impaired the muscle repair process.
So you're robbing Peter to pay Paul, which normally I'm okay with.
Right.
But in this case, maybe that's not okay.
Right. So now you're like, well, now what am I going to do? I just sprained my ankle. What should you do? So the guidelines kind of all of the research says, if you're going to ice your ankle or any part of your body that you injured, it's probably in the 15 to 20 minute range.
Right.
And every 3 or 4 hours, not constantly, because that constant icing can reduce the blood flow to a point where it's bad for you. Also, theoretically, could cause frostbite or damage to the skin. And same with anti-inflammatories. So anti-inflammatories are good at reducing the pain, reducing the swelling, typically for a shorter period of time, like in that 3 to 5 day range. But you should not be taking them for weeks on end because an ankle sprain takes a long time to heal. Like 4 to 6 weeks, even beyond. So you don't want to keep taking it the whole time. Once you get past that acute phase of the 3 to 5 days, if you're still sore, consider something like acetaminophen that does not impact directly the inflammatory pathway.
Central acting medicine.
Okay.
So that's injury or trauma. Now, what about trauma and injury that we cause with our surgery?
Hopefully all of our patients that have had surgery did not leave the video yet because they're like, wait a second, they told me that I got to take anti-inflammatories. I have to take, I have to use some type of cooling device or ice packs or whatever to reduce the swelling in order to get through my operation, particularly hip and knee replacements is what we do.
This is a different ballgame.
Right.
This is not a natural thing. Having surgery is not natural.
Right.
Trauma, stepping in a pothole while you're hunting your food, that's natural.
Yes.
This surgery is not natural. So interfering with the inflammatory pathway is okay and necessary after a surgical procedure.
Right, not only to reduce the pain and the swelling, but also to facilitate recovery. So particularly for knee replacements, this is what allows you to regain your range of motion, allow you to ambulate faster. And they've done studies in 2020 that show that cryotherapy as well as anti-inflammatories, compared to a group that did not have those benefits, they do worse. They have worse functional outcomes and more pain.
Well, if you use cryotherapy,
anti-inflammatories,
you do better.
Yes, they do better than the group that did not have them.
Yes.
And also reduce narcotic consumption, which certainly is a concern nowadays.
Right? And for us with the knee, the big thing is stiffness after the knee. So if you're so inflamed, so swollen, so much pain that you can't bend your knee after your total knee replacement, then you may end up with a stiff total knee replacement, which doesn't really have a good cure.
No. So what I would say is, are there still some risks even in the post-surgical patient?
Yeah,
for sure. So
always risks.
Theoretical risk of frostbite. Obviously, if the wound is wet from some type of cooling device that's making it wet, that can be a problem. And then anti-inflammatories, all of their inherent risks of bleeding, kidney disease, risks to your heart. So you have to be a little bit careful.
And your GI tract too.
Yeah.
You get ulcers.
Yeah.
So interfering with the inflammatory pathway in the trauma situation,
Yep.
we think is okay acutely for a few days, but not on the long term.
Right.
Interfering with the inflammatory pathway after a surgical injury or a surgical procedure, we think is okay.
Seems kind of self-serving as search ends.
Well, I mean, not really.
Yeah.
We're not, selling the inflammatory.
No.
But that we think is okay.
Yes.
All right, because that is going to help get you a better outcome.
Yeah.
As opposed to the traumatic situation where long-term interference with the inflammatory pathway might make your outcome worse.
Yeah, we just wanted to clarify because there's a little bit in social media and on the internet saying, hey, maybe we shouldn't be using rice anymore. So the answer is yes, you still can use it. You just have to apply it appropriately.
Yeah, and it's two completely different scenarios: injury versus surgery.
Dr. Merkin would be proud.
Right?
If you like this video, please like it, subscribe to our channel, check out our little long-form content over on YouTube.
This one's for you, Merc. Remember, you are in charge of your own health.
See you next time.